Hi everyone, my name is Matilda Park. I am a family nurse practitioner student. I am here to presenting you guys my pocket guide for my clinical rotation. I did use it 5x8 3-ring folder to use for my pocket guide because I think it's easier to carry than the big one, and then I also use the divider to divide them into subgroup. I categorize them into population of pediatric, geriatric, pregnant, women health, and also primary care screening. So let's get started. So as a first group, I presented you guys with pediatric population. So in this one, I included well child visit, milestone, and screening. So it will go across from a day old to crossing to 18 years old, and then it will include what vaccination which age group need or what kind of screening should we give them at that age. And I also include my quick reference for the growth chart from 2 years old to 18 years old. So we change to boy and a girl here. So it will be my quick reference when I needed it. And also I included the vital sign for my pediatric population. So this will be the quick reference for me when I find the abnormal vital sign for my child visit. So next group will be women health. So I added here with preventative screening guidelines. So my women health promotion start from age 13 to 65 and older. So also the same, I would group them in age group, and then what kind of vaccination or screening they need in this age group. So will be helpful for my patients when they come and visit, and then I will be recommending them for any screening and vaccination. Also I included here memory gland screening. So I put it here what it aim for, when to conduct the screen, and then step to follow here. So I'll have my own quick guidelines when to perform this screening. And then I also added normal and abnormal finding. So if abnormal finding, what is next step I should do. Also next one is menopause symptom and screening. So I added here common symptom for menopausing women, and then what should be scanning or screening, how we diagnose it in primary care. Also the pap smear test, and so I did routine purpose of pap smear here, when should we conduct it, and how to perform the pap smear, also using the tool here, and then expecting finding, and then if we have abnormal finding, what is next step should we do. Next population will be pregnancy group. So I put the quick screening abnormal sign of pregnancy in primary care, quick reference in first trimester, second trimester, and third trimester. So I'll put the quick reference, what could cause that, and then what action should we follow for each side symptom. And next one is my geriatric group. My pocket guide is heavier in this group. So I put first with the geriatric screening checklist, which is of 9 topic, as far as cognitive rates, depression, medication, functional status, nutritional screening, vision and hearing, bone health, and humanization screening. So as go along from this page, it's just the reference from this, what test and screening in this checklist should be included. So it will go by alphabetically. So I'll start with ADL and IADL functional status. This screening is screen for activity of daily living, and then we want to see if our older adult patient can still take care of themselves, or they financials or medication. If they need it, we have to refer them to higher care to help them. Next one is depression screening. We use the 515. I included here the 15 question that we should ask our patient, and then the scoring system here to see if they're screening positive or not. Also included EAR criteria, the high risk medication that we should be avoid in our older adult. So I put it here, the medication to avoid, and the medication that should be using instead right here. Also the bone health, bone density screening, so we use DEXA scan. I put it here, routine screening for age group here, and then also the T-score, and then what the meaning and what action should they take, and then also a quick reference for C-score here. Also management of osteoporosis high risk. And next one is mini nutrition assessment. I put it out here, just the self-assessment for our patient. If they scan for malnourishment, we can refer them to the dietitian. And next one is cognitive assessment. We use Montreal cognitive assessment. I put it here also, purpose of it, and then advantage of it, and then clinical tips here for the quick reference. Also mini mental state examination also included here. And last but not least is the forest assessment. We use talk test or time up and go. So I put the instruction how to perform the test here, and then this test will be determined if our patient is have unsteady gait or steady gait or high risk of forest. So last section I included it, primary care screening. So it will go by alphabet again. And then I started with asthma screening. So I put the CHINA guideline, like what medication should we start and when to use it. And also next one is COPD assessment screening. I also put gold standard of care here, so we can be a quick reference to use for our patients, and also how to differentiate between COPD and asthma. Next one will be the lipid panel screening. So I put a quick reference here, why screening for lipids and when to screen, and then what included in standard lipid panels is right here. I'll reference it, and also the target level of our cholesterol in our body, and also this is a quick lipid chart reference that I can use. Also next one is huge, I believe, diabetes screening. So I also put the quick who should be screened, which age, and then screen test, which like how we diagnose diabetes, and also I also reference for pediatric criteria, and also our patient population, like pregnancy screening for diabetes. If they great screening positive, what is the next step should we do? Next one is domestic violence assessment. I feel like this one is very important, and then I put the definition in here, and then what is it, and then when to screen it. It said to every patient and every visit we should screen it for domestic violence. And then I put the tool here. We use heads, and other tool is stat and race, and how to recognize sign and symptom of violence, and also what to say during interview, and also what the next step if you tested positive for it. How you can document this finding. I feel like it's very helpful. Also, next one is anxiety screening. I also include it's GAT7, so everything you need, when to use it, the scoring system, and then red flag, and then I included the questions here in the back. Next one is hypertension screening. So I use a JNC8 guideline. I put reference for blood pressure range from normal to elevated BP, and then stage 1 and 2 hypertension treatment, and then lifestyle modification guidelines. And also here, depression screening, we use PHQ-9 screening. So the same, what is it, when to use it, and then how you score it, and then what the red flag. And I also include the test here. Next one is post-traumatic stress disorder. So I also include what is it, when to screen, and score system, positive screen, what we should doing is the next step, and what is the red flag right here. Also I included the question that we should ask our patient right here. Next one is stroke protocol and management. I included the acronym here, be fast, to be recognized our stroke patients in our primary visit. So it's right here, and then what is policy or step to follow after you find that patient having stroke. Also, next one is substance screening. I use one audit C for alcohol use, also -10 for drug abuse, and then another alcohol use screening tool is the case one. This is a follow-up one. And last but not least, I also included vaccination guideline here. I included all age groups from pediatric to our elderly, 65 and older adult. So it will be quick reference for me what age and then what vaccination we should get. And this is my blank page for whenever I get more information, or if I want to add something, I can write it down in here. This is all from my pocket guide. Hope you enjoy it. Thank you. Bye bye.